In Nigeria, we all want to have healthy and happy children. This begins when women receive the care they need when pregnant, babies are delivered in a safe environment, and children are given the vaccinations essential to protecting them from disease.
Mahimmancin awo a gare ni shine saboda ya kare min lafiya na da lafiyan ɗana.
But in parts of Nigeria, the rate of deaths amongst mothers and children are some of the highest in the world.
In northern Nigeria, a lot of people who shouldn't have died, who shouldn't have suffered from illnesses, are suffering.
Most mothers give birth at home without the benefit of a trained birth attendant, and once born, less than 10% of our children are fully immunized.
For the woman to deliver safely, for the child to be immunized, is not the responsibility of the mother only. It's not the responsibility of the father only or her parent. It is a communal responsibility.
But after years of neglect, facilities are dilapidated, most lack basic drugs and equipment, staff are untrained, demotivated or absent, and communities lack the knowledge or support to demand the health services they deserve. This film looks at how an innovative program is supporting communities, health workers and government to work together to overcome these challenges. The program is managed by Health Partners International, Save the Children UK and Grid Consulting Nigeria. It's called the Partnership for Reviving Routine Immunisation in Northern Nigeria, Maternal, Newborn and Child Health Initiative. Good quality healthcare for mothers and children requires everyone's support and involvement. So PRRINN-MNCH began by working with all the stakeholders in the 4 key states of Yobe, Jigawa, Katsina and Zamfara to understand the problems and look for solutions.
There is serious disconnect between the community, the people and the service providers and the government. No any woman would like her child to suffer. No any husband would like his wife to die. But then because of this wide gap, they don't know what to do, how to do it.
To meet this demand for knowledge, PRRINN-MNCH supports community engagement activities.
So we are in Ilela community now. This is one of our community engagement pilot community.
Now many communities are empowered to learn about and discuss the benefits of using health services.
Aka ce ta da yawa ƙwarai da gaske an samu rayuka da aka ce ta da yawa. Wanda da wasu abubuwan da suke faruwa mu ba mu san su mai da su wani abu ba. To da aka karantar da mu kuma sai mu gane lalle wani abu ne mu gane lalle suna cutawa mutane a cikin rashin sani. Na mun koyar da jama'a sosai. Dan ba mu akwai makwatan mu wanda suke suna zuwa suna ɗaukar darasi a gurin mu kamar na wani gari haka.
Many mothers and children are beginning to go to health facilities for the first time in their lives. In Gidam, Yobe State, pregnant women have gathered for an antenatal clinic.
We have eclampsia, anemia in pregnancy, malaria in pregnancy. We have antepartum hemorrhage, postpartum hemorrhage. All we are facing here.
To improve the level of care that patients receive from health providers, PRRINN-MNCH has worked with the state government to train community health extension workers, midwives and doctors, giving them essential life-saving skills.
PRRINN has contributed immensely to that side, and I tell you that a lot of us were trained. It has really increased my confidence. Managing your patients, you find that the confidence has increased, or you manage your patients better.
Midwife Fatima Bukhar has seen a marked increase in the number of pregnant women attending the clinics.
I want to save the life of women by giving them health talks telling them the dangers that pregnant women face.
Wannan hatsari ne in mace bata dauki mataki akai ba matakin kuma zuwa asibiti. To ɗaya daga cikin su menene? Ma kamar jini.
And she is seeing a decline in the number of deaths.
It's reducing now. By awareness, it's getting better.
Haihuwan asibiti da na gida bambancin su. Na gida ba za ka samu wanda zai kula da kai mai kyau ba. Amma idan ka zo asibiti za a kula da kai kuma za a kula da yaranka.
Through community engagement, it emerged that lack of emergency transport for pregnant women was often the reason women delivered at home, even when there were serious complications.
We know that there are certain communities that even cars do not get there until the market day, weekly. And we know labor comes any day, any time. So we know then we have to make a special arrangement.
By working with the National Union of Road Transport Workers, an innovative solution was developed where drivers are trained to provide emergency transport for women in labor.
Yana daga cikin waɗanda suke taimakawa. Dan ko cikin dare ne za a zo a tayar da shi. Su je su taimako su nema mota a zo a sa a tai da su. Za su je sai an haɗa komi da komi na aikin da ake yi sannan zai dawo. Ko da safe ko kuma sai rana ma ta ƙare sun wuni can sannan za su sake dawo.
Many people have benefited on this program, and people have achieved a lot. And in fact, it has saved a lot of lives, more especially pregnant women and newborn children.
To address the problems in the health facilities themselves and to plan effectively, it is essential that policymakers have accurate and up-to-date information about the situation on the ground and the needs of each location.
Formally when we plan, what happens is that the management will just sit and plan what they need to do and do the budget like that, without looking at what is happening within the community. Where PRRINN was working to see that we have, a data capture and then a storage system, and then at any time that we need to plan, we can see the data, see the areas where, we have problems, and then we plan towards solving that problems.
Another critical area that needed to be addressed was the lack of information on the human resource needs.
Some local government, they don't have a single doctor. They have only 1 or 2 midwives. And this is a local government of between 400 to 500,000 people. How do you take care of these people?
We found that we have an inadequate number of trained staff to man all these facilities. And, it's helping the state to see areas where, they need to improve, whether in the medical doctors, midwives, comparing the number available with the number, on ground.
By identifying and understanding key human resource issues and challenges, the states are beginning to form appropriate strategies and interventions to address them. Okolo Chinue is one of the newly appointed midwives.
Before we arrived, there has not been capable hands to attend to them. So when we arrived, we made a change. There was a difference. As you can see from the data, when we came in January, we only had 28 as the total ANC. But I think we had the highest figure in October, 106.
Especially in terms of these maternal deaths, we've not been able to record not any. I'm so happy about it.
After birth, it is critical that children receive a full range of routine immunizations. In parts of Nigeria, this routine immunization had all but collapsed. PRRINN-MNCH has supported the revival of routine immunization by raising awareness and improving vaccine supply. Health staff have been trained on all aspects of routine immunization, and regular vaccine supply has returned to thousands of facilities. Repairs to all solar installations have ensured that the hot climate does not destroy the vaccines.
abin da ya sa rigakafi ya fi komi don irin kananan cututtukan nan ya kamata ka zo ka yi don kare kansu kamin wannan cutar ya fado ka riga ka kare su da wannan cutar abin da ya samu ka zai.
PRRINN-MNCH has also supported the development of a sustainable drug supply and vital infrastructure improvements. For all of these reforms to be sustainable and to unify the fragmented structure of the healthcare services, PRRINN-MNCH has been supporting the development of primary healthcare boards in each state.
The guy who works in primary healthcare is employed by one agency. He has to work under another agency. The technical support that he gets is coming from another agency. You know how it will be like, it's going to be confusion. But now, what has happened is that everything has been brought under one board. So it is this board that gives the technical oversight. It is this board that engages the people. It is this board that directs everything.
Considerable progress has been made towards improving the quality and availability of all maternal, neonatal and child health services. But significant challenges remain, and we need to work together to reach our goals.